You know, our union includes caregivers from San Diego to Eureka, and we are very proud to be members of Healthy California Now. The leaders of our union have been organizing for more than 30 years now to achieve single-payer healthcare system that provides everybody with equal access to quality care. Unfortunately, during this same period, the healthcare industry morphed from community-driven care to corporate-driven care. The mantra became just-in-time inventory, just-in-time staffing. And healthcare workers know that really means unsafe staffing and not enough supplies. This is not a new problem, but COVID-19 showed just how dangerous corporate healthcare's profit-driven model is for caregivers and patients. California entered the biggest public health emergency in its modern history, with its hospitals short on N95 masks and short on healthcare workers needed to care for patients fighting for their lives. Hospital corporations that received billions of federal stimulus dollars refused to implement appropriate safety protocols and routinely denied caregivers access to COVID testing, even in cases when workers were exposed to COVID or were already symptomatic. At the same time, millions of Californians either lost their health care along with their jobs during the pandemic or couldn't afford to use the health care that they had because the deductibles were so high. The pandemic should be a wake-up call for everyone that health care is a matter of life and death, not dollars and cents. More than 63,000 Californians have died from COVID-19. Black and brown Californians have died of COVID-19 at more than twice the rate of other Californians. Nationwide, 1/3 of COVID deaths were linked directly to the lack of health care insurance. You know, our state is the 5th largest economy in the world. How many lives could have been saved if every Californian had access to health care and every Californian with health care could actually afford to see a doctor?
28,000.
We are here today to mark the state's official reopening, because if there is one thing that should be clear to everyone after the past year, it's that we need Medicare for all in California. There are too many lives at stake for us not to act now. Thankfully, we're on a real pathway to achieving Medicare for all in our state. For the first time, we have a governor, Gavin Newsom, who supports Medicare for all. He campaigned on accomplishing it. Also, for the first time, we have a U.S. Health Secretary, our former Attorney General, Javier Becerra, who also supports Medicare for all. Governor Newsom and Secretary Becerra have a long history of working together. Now they have the authority to collaborate on a plan that would allow federal health care dollars already flowing into our state to help fund a new single-payer Medicare for all system. While they work on securing the necessary federal waivers, Governor Newsom's Healthy California for All Commission can lead a public process with stakeholders to determine how to craft a system that makes health care a human right and provides equal access to care for everyone that live in this state. This is the fastest track to Medicare for all. What's necessary to get it moving, its leadership is from Gavin Newsom. That's why we're here today, with thousands of petitions signed by Californians just like us, who support the governor and believe that health care is a human right. We elected a governor who supports Medicare for all.
Yes.
Now, we're going to stand with Gavin to defeat the right-wing recall effort, and then, with the partnership of Senate Pro Tem Tony Atkins and Assembly Speaker Anthony Rendon, we are going to work with Gavin Newsom to seize this moment in history, to make California the first state in the nation to achieve Medicare for all that guarantees health care for everyone that lives in our state. You know, I'm pleased that over the last months, our coalition has gained the support of Senator Atkins and Speaker Rendon. They weren't able to come here today for legislative reasons, but we received a statement from the Speaker last night that I'd like to read to you. I believe healthcare is a human right, and it's imperative that we take the steps necessary to provide all Californians with universal access to quality healthcare. I strongly support Healthy California Now's efforts to pass and enact single-payer healthcare in California. Seeking federal approval to use existing healthcare dollars as the foundation of a state-sponsored plan will be a critical step towards successfully providing universal healthcare through a single-payer health system. I applaud Healthy California Now for their relentless and determined efforts to make this happen, and I am pleased to continue working them to achieve this goal. California Assembly Speaker Anthony Rendon.